been given a case of drowsiness and confusion. Regarding differential diagnosis, make a quick list of possible causes of a given presenting complaint, and ask questions to rule in, or rule out the possible differentials, as in this case, diabetic ketoacidosis, meningitis, alcohol or drug intoxication, are the top differentials in our list. Here, we are discussing relevant questions to take a brief history, keeping ourselves structured within a given time frame. Now, we ask detailed questions using the mnemonics ODPARA. Onset. How did it start? Did it come on suddenly, or gradually? Duration. For how long is it present? Progression. Since the start of symptoms, is it getting better or worse or staying the same? Is it the first time, or were there previous episodes? Aggravating factor. Have you noticed? What makes it worse? Relieving factor. Have you noticed? What makes it better? Associated symptoms. Polyuria and polydipsia. Preceding acute illness. Recent high glucometer readings. Nausea, sweating and breathlessness. Poor compliance with insulin. Smelling of alcohol. History of drug abuse. Alcohol and drug history. For quick recall about the causes of confusion, remember: for eyes, insulin forgotten, infection, infarction and injury. At this point, we have ruled out possible differentials and make our approach align towards a possible diagnosis. To support it, we can perform a quick physical examination and lab investigations. As in this case, we can check Glasgow Coma Score, breath, for pure drops, ketones, hyperventilation or Kussmaul's breathing, metabolic acidosis, medic alert bracelet finger prick marks, diabetes, retina, diabetic changes, papilledema, pulse and BP, hemodynamic compromise, auscultate chest, aspiration pneumonia, gastroparesis due to diabetic autonomic neuropathy. Now it's the time to tell the patient about the management part, including investigations and treatment. Regarding investigations, we have options of finger prick glucometer, urine dipstick and finger prick for ketones, ABG, metabolic acidosis with respiratory compensation, full blood count, LFT and glucose, ECG, silent MI, blood and urine cultures, sepsis, chest X-ray, pneumonia or aspiration. Regarding treatment, we have plan of fluid resuscitation, crystalloid. Consider potassium supplementation, IV insulin sliding scale. Consider NG tube to prevent aspiration, heparin for venous thromboembolism prophylaxis, antibiotics for infection. Meanwhile, address the concerns of the patient. In the end, it's the time to close the case and talk to the examiner.